Hi, I'm Jim Brett, President and CEO of the New England Council. Thanks for tuning in to this month's episode of Inside the Corner Office, where we catch up with the leaders of some of our region's most well-respected businesses and organizations to learn more about their career paths and about the institutions they lead. This month, I had the opportunity to talk with Jean Yang, the President and CEO of an incredible organization here in New England called Vinfen. Headquartered in Cambridge, Vinfen is a provider of community-based services for people with mental health conditions, disabilities, and life challenges. In our conversation, Jean shared more about Vinfen's work to serve some of our most vulnerable members of our society and about the critical importance of investing in community-based services to expand access and decrease costs. As always, I thank you for tuning in. I hope you enjoyed this episode. Jean, thanks so much for taking the time to join me today. I've enjoyed getting to know Vinfen since the organization has joined the New England Council, and I'm looking forward to learning even more today. But before we talk about Vinfen, I would love to learn a little more about your extraordinary background. You have a very impressive career in the healthcare sector with experience spanning across the payer, provider, and government entities. Can you share a little more about your career path and how you got to where you are today?
Thank you. Thank you, Jim. Thank you for this opportunity, and thank you for your kind words. It's great to be here to spend a little time with you to talk about Vinfen. In terms of myself, I actually started my career in general management, and I did a little bit of management consulting as the early part of my career. And I started in healthcare by joining Tufts Health Plan as my first, which was my first client, as a consultant. So I would say coming to healthcare, it feels a little accidental, but is actually inevitable from my perspective, because the minute I started to do healthcare work 20 years ago, the issues really related to me as a consumer. I found the people that I was working with very, very easy to connect with, and also the topics were so vastly complicated. It really triggered my inner curiosity to really do my best. I would say it took a few more years for the mission part to kick in. You know, oftentimes we run into people who say, you know, we come to this industry because of the mission. I think for me, the first part was more curiosity, but the mission part got me to stay for the 20 years that is behind me, is when I started to be face to face with the people that we're serving. When I was at the state government doing universal health care, for example, being face to face with people who needed health insurance but weren't able to get it, and then people who have serious medical conditions struggling with the system that we had. So it just became so clear to me in terms of what was right, what was wrong, what was non-negotiable, and what was something that we absolutely had to do. So I'm proud of the mission that I am part of right now. That is really what I'm here for.
Mm-hmm. So the transition from healthcare management to the human service sector, you made that because you...
Yeah, that's a good question, Jim. So when I went into healthcare, it became clear to me and many others that it really is it's a village, that you had many, many different parts of the system that were more or less working on related issues. So there's the payers, there's the providers, the regulators, policymakers. And it's really when they had to sort of come together, that's when we make progress and then find a common ground. And then so I did a little bit of a world tour, if you will. I spent years with insurance, spent years in hospitals, spent years as a public servant. So coming into human services, again, it may feel like a change. It's actually a natural part of that continuum from where I sit. Health and human services actually have always been sort of this same ecosystem, if you think about it. When we have people who have illness, it's what they need is not just treatment, but also recovery, but also management of their health. And for many, it's also about living with conditions. Which means that we not only need to give them medical care, we also need to give them support, which could be not clinical, which could be social in nature. And that is the continuum that we emphasize. And human service organizations like Vinfen really focus on that continuum and that interface between the clinical work and the non-clinical work. You probably have heard the term called social determinants of health. And that is something that is appreciated by more and more people these days, just the importance of recognizing social factors in terms of their impact on health outcomes. So in fact, research suggests that social economic factors contribute more than 20% of the health outcome. And if you throw in individual behavior, which oftentimes is informed by social conditions as well into there, there's at least 60% of the influence. That's before we talk about things like genetics and healthcare infrastructure. This is hugely important. So when we work with people who sort of struggle with serious conditions, you really need to think holistically about what they need. So that is sort of the connection between healthcare and human services. So in my most of my 20-year career in the sort of healthcare side of the world, I work with public healthcare, if you will. So when I was at Tufts Health Plan, for example, I led the Medicaid business of the company. And when I was at Children's Hospital, I was also working on what we call Medicaid Accountable Care Organization. And obviously, when I was at the state, I was working on subsidized health insurance. I'm very familiar with the vulnerable population and then their needs. And then when it comes to the vulnerable health population, it shouldn't be a surprise that mental health issues and disability issues just had a disproportional weight. So in other words, I had been dealing with mental health issues well before I entered Vinfen. In fact, it had been clear for some time now, it was really that frontier that we need to get to and I needed to personally get to. So Vinfen was really just an opportunity that was perfect for me at the time. And it's been a true privilege to be part of Vinfen.
It sounds like a perfect fit. You must have known.
I hope so.
Well, you must have pinched yourself to say, as you're being considered, this is my mission now.
I tried. I
Yeah.
hope the board heard
Yeah.
that, but it is absolutely the truth from my heart.
Yeah, well, it comes across, obviously. Let's shift gears and just talk a little more about the incredible organization you do lead. For those in the audience who may not be familiar with Vinfen, can you just give us an overview of the organization's history and the types of services it provides to our patients here in New England?
Thank you, Jim. Well, obviously you are an expert in this field yourself, but I would say that if I talk to anybody in the street, chances are that they know someone, whether it's a family member, a friend, just someone in the neighborhood who has a mental illness, has an intellectual or developmental disability, or someone who had an unfortunate accident that sort of caused a brain injury. So people who have these serious challenges that they have to live with. And that is the people that we serve, and that is what Vinfen does. So in other words, Vinfen is a human services organization serving people with mental illness, intellectual developmental disabilities, and brain injury. And we provide a community-based services as opposed to institutionalized services, because our emphasis is that, people who have these challenges, they have the right and then to live with freedom, dignity, support in the community, just no different from you and me, but they need help to make that possible. So that's what we do. We have been doing this since 1977. In fact, we started with what we call a group home. So this is a 24/7 program where we have places like just like a home, like you and I would live in. We could house anywhere from 4 to 8 individuals who share this home, but instead of their family members, we have Vinfen employees doing the cooking and cleaning and helping them out, giving them a home to live in. So we started with setting up a home like this at 58 Fenwood Street in the Longwood area across the street from Brigham and Women's Hospital. It's still there. The Vinfen birthplace is still there. It is on the corner of Fenwood Street and Vining Street. So that's how we got our name, Vinfen. But obviously, over the past 47 years, we went from one group home to an organization that spans across Eastern Massachusetts, from New Hampshire border all the way to Nantucket and Martha's Vineyard. And we proudly serve over 10,000 individuals. And we work with a workforce of 3,200. So we are a sizable organization now, but our mission has not changed. And we take pride in serving the people that we serve.
Great. You know, when you talk about the group homes, that leads up to my next question. One of the biggest challenges that all of the human service organizations face in their day-to-day is the shortage of qualified workers willing to take on the very, very, very challenging roles. Can you share what you are experiencing at Vinfen when it comes to workforce challenges, and what steps you're taking as an organization to address that issue?
Yes, that's a really important one. So, and while I started with the group homes, obviously Vinfen actually does a lot more than the group homes. We also have day programs where we help people, give them employment training, and then connect them with different services. We also do outreach work for people who live with their families or independently. We also do clinic work and even crisis services. My point is our workforce is vast. Not only the number of people that we work with, but also the type of skill sets. So we have clinicians, we have psychiatrists, we have nurses, we have community health workers, not to mention different kinds of administrative personnel as well, just to support the complicated work that we do. So that really makes the question that you asked, a really critical one. So how do we sustain a workforce that is so mission critical? At a time when the labor market is not the most generous, so we are struggling pretty significantly. We're not the only organization, but the labor market, particularly when it comes to the low wage workers segment, it's been tough. So at Vinfen, we try to do a lot of things. We certainly try to provide a lot of training and the support for the people that we hire, that we try to retain. We try to create very strong workforce support, workplace support, so that people feel that they are respected where they're working. There are people that they can reach out to when they need help. We have a very strong, I would say, frontline management team. So the frontline managers who have been in Vinfen for many years, they know the work really well. They're highly experienced. They can teach. They can model. So these are role models to our staff. These are role models to me. That's how great that these managers are. But we rely on sort of our effort to make our workplace as strong, as supportive, as resilient as possible in order to maximize our ability to retain the workforce and attract the workforce. We also do career ladder development. We try to encourage people to develop long-term career in our company. You know, one thing that is good about being a large company is that we have many different types of opportunities that people come in at the entry level, they can learn new skills, they can pursue management track, they can develop sort of technical proficiency so that they can become specialists of some kind. We send people back to school if they want to pursue additional training. We provide all kinds of support. And then we try to be there when people are looking for career guidance. So we're very, very proud of all the work that we do. However, Jim, fundamentally, while we do all of the things to support the workforce, the most important thing is to pay them fairly. There is nothing that can replace the need to have a livable wage for this hardworking workforce who deserve no less than the ability to live a decent life. So unfortunately, as this sort of predominantly government-funded sector, if you will, we are not in a position to pay very high salaries. And in fact, it's been a struggle just to be competitive in the labor market, which is why we spend a lot of time, we do a lot of work to work with lawmakers and regulators to advocate for adequate funding for this workforce so that we're able to support them. This is the safety net of our society. We cannot afford to have this industry not being stable because it would be the most vulnerable people that are exposed if we don't have the right workforce. So we do a lot of that. In fact, this morning we were at State House meeting with a legislator to talk about this issue. Fortunately, we feel that our voice is heard. We just need to do a lot more on the advocacy front so that our workforce can be supported.
Right, I agree. You know, it's ironic when you could look at the salary of a Starbucks worker,
yes,
and compare it to a personal care attendant taking care of somebody administering medicines, and just a very difficult patient that needs an awful lot of care and attention, and to realize that person gets far less in wages than the Starbucks worker. There's something wrong.
Something very wrong.
Something wrong with that system. And I think that's why you see such a high vacancy in all the agencies throughout the country. It's not just a New England issue, it's a national issue. Vacancies are occurring all over the country. And then you have a high turnover of these dedicated workers. And so anything we can do to keep advocating, obviously, is going to help make the cause, be realized and make it a top priority of the legislators, both here in the state and in Washington. So, and the only thing I'd recommend is we have a report the President's Committee on Intellectual Disability just published, and we hammer away again on the personal care attendant and what needs to be done to make it truly professional and give opportunities for advancement and give opportunities for additional salary. But just got to keep using our voice. But you're doing well at it, and we thank you for that support that you give, and because people will listen to you, lawmakers in particular. It seems that not a day goes by that we don't see another headline about the housing shortages here in New England. And I know that access to safe and affordable housing is particularly challenging to say the least, for people with disabilities. Can you share more about how Vinfen works with this population to help us navigate the resources available?
That is a huge part of what we do, Jim. If you think about the work that we do, we support people who live with challenges. They need not only sort of human support, but they also need homes. They need to have a stable living environment. So we do a lot of housing along with everything else that we do. So Vinfen operates, over 200 group homes, and then we have over 500 sites. If you think about it, also all of these, whether it's a day program, whether it's an overnight program, whether it's a clinic, it's an outreach site. So we have all kinds of facilities that we work with. So this is something that as an organization, we have developed some critical competency. But speaking of housing, you are absolutely right. That has become such a huge challenge. And the sad thing is when housing becomes this increasingly scarce commodity, it is our people that are disproportionately affected, because our people are those who need housing the most, and they're the least equipped to find housing by navigating this impossible sort of system that we have. So we do housing by a variety of different things. In addition to just operating roof over people's top, over their head by having these homes, we also help people who need to have their own apartment or other housing arrangement by having them access subsidized housing, having them sort of file applications for rental subsidies, all kinds of support that so we have a team of experts who know all the rules, all the forms that need to be filled, where to get in line and train our people in terms of gaining knowledge about how to not only obtain home, but protect their home as well. We do tenancy preservation by negotiating with landlords, local authorities. We intervene when people are at risk of losing their home. So we do a lot of work, anything that we can do to support our people either retain or access housing. We have contract with Mass Health directly and insurance companies and managed care organizations and provider accountable organizations. So the good news is that these days the healthcare entities and agency are more and more focused on the importance of having stable housing as part of the holistic care that we need to provide to people. So we feel that there is strong awareness, and then we have strong capabilities to do that. But then again, the biggest problem just aren't enough housing. So when there is such a shortage of housing, period, that everything that we can do sort of from a procedure perspective can only go so far. That is why we strongly support any and all policies that promote the availability of affordable housing, because ultimately that is the only thing that can make the biggest difference. But in the meantime, we keep busy.
Yeah, right. No, I hear you. There are so many nonprofits in the region here that even when a home does come on the market, they can't afford. They don't have that kind of resources to pay $2 million or $3 million, and that's unfortunately some of the prices that are being asked. So one thing that the state is doing is they're working with developers and saying to developers, look, if you're building a 60 unit somewhere, that you should set aside X amount for people with disabilities. And also that they not be segregated in one unit of that development. They be part of the community. And we also have tax incentive programs that will be attractive to developers. So it's a way of addressing the long list and the waiting list of people who said, I'd love to live in the community, my son and daughter, but there's such a long waiting list. And the group homes just aren't appearing like they once did because we don't have the resource. But developers are now stepping up to the plate when they're saying we're building some development and we should be setting aside and we want to work with the state on that. That's a good sign. So we have to be creative, thinking outside the box.
Creativity is the key word, Jim. It's just we work with some of these developers as well. We think it's a very good thing that there are some of these knowledgeable and ultimately mission-driven developers who are actually very interested in committing to this space. But we need more. We need more participants in this kind of work so that we can solve what seems to be an increasingly difficult to solve issue.
Absolutely. You recently authored a very, very well written op-ed in the Boston Globe highlighting the importance of investing in community-based behavioral health, particularly in the light of the recent closing of several hospitals by Stewart Health. One in my neighborhood in Dorchester, the County Hospital, had, a significant number of psychiatric beds there that were desperately needed. We have a shortage, as we know, throughout the Commonwealth. But the point is that is now closed. So Can you talk about how these types of investments hopefully can help improve access to care, though, that you're talking
Yes,
about?
this was such an important platform that we are very thankful that allowed us to sort of bring to light this critical issue. Something, you know, broadly can be characterized as what I say, the sort of the capacity of mental health. So if you think about, you know, capacity, it is just about whether there is enough infrastructure, whether there is enough services that are available relative to the needs that are out there. And we can talk about everything that is wrong with mental health, but the most important thing is just that we simply don't have enough services. And the difficulty about capacity is that unlike, you know, pricing or otherwise different kinds of rules, you cannot change overnight. Because if you don't have enough services, it requires building new programs, it requires hiring people that don't quite exist, and then you have to really build things that takes time. There just hasn't been enough attention to this critical issue about capacity. And on top of that, we have this issue with mental health, with sort of different programs working in silos instead of a system that is cohesive. So when you don't have a cohesive system, what you have is an exacerbation of the problems associated with insufficient capacity to begin with. Because what you have would be sort of bottlenecks, right? When you have bottlenecks, if you think about it, then even if you're building capacity downstream, it wouldn't help because everything is stuck in here. So why is system so important? The system is important because the people that we serve, their circumstances will change, right? Imagine, remember, these are people who have illness. They receive treatment, but they could have a new development. Things could change. Someone who has had a mental health crisis, we're fortunate to intervene and help them de-escalate. But what they really need right after is some kind of ongoing sort of support and monitoring, because otherwise they'll come right back in 3 weeks, right? So this is where we say, okay, when you don't have a system, you don't have a handoff, then long-term progress is not going to be made. So in our system, again, that was highlighted in the op-ed, there are at least two very prominent bottlenecks. The first is the emergency room. So people go to the emergency room, there are no place that the emergency room can send them. So therefore, these people are completely stuck. And then because we don't have the step-down services. The other place is actually the psychiatric hospitals, where people who went through a, you know, most of the time, very difficult episode of inpatient treatment, but they're ready to leave inpatient setting and go into the community. But because we do not have enough capacity in the community for people who we serve as Vinfen, then there's a bottleneck in the inpatient setting. So that's what we are talking about. So this is such an important topic that we call for policymakers to really focus on making the investment in the right place so we can sort of dissolve these bottlenecks so that people can get to the next level of treatment so they can actually make the kind of progress that we need. The one program that we highlight is what we call the adult community clinical services. So that is a very big program that's part of Vinfen's portfolio. We serve over 2,200 of these individuals. They all have serious mental illness. And what we do is that some of them live in 24/7 group homes. Some of them live on their own, but we provide intensive treatment. So we make sure that they have stable access to medication, that we monitor their recovery. We support their life. We even sort of provide them with opportunities to develop activities and even employment. That is what we need. This kind of community services, they have the clinical rigor built in, but they also give people an opportunity to thrive in ways that they need. And then this is not only sort of better for people, they are so much cheaper than institutionalized care as well. But unfortunately, these services are in such shortage that we have long wait lists. And we feel that these are problems that are solvable. We just need more and more people, from opinion leaders to lawmakers to everyone on the street, to really appreciate the importance of this, so that we can all put our heads together.
I know that Vinfen has experienced incredible growth since its founding nearly 50 years ago. But I'd like to know what your vision is for the organization in the next 5 to 10 years.
Well, thank you, Jim. Humbly, while I've only been in the organization for 2 years, I really have to credit my predecessors and my colleagues at Vinfen for the growth. We did indeed grow significantly from this one group home 47 years ago to this large organization. But that said, going back to what I just said, the growth of Vinfen, or the sector as a whole, has lagged the growth of the needs for the services. So we have not been able to meet the needs of people that we are committed to serving. So that we have a lot more work to do. And then we need policy support for the investment in these services. And organizations like Vinfen need to continue to advance, to sort of push ourselves to do more work, and then do work with more sort of effectiveness with more technology, so that we can serve people better. There's a lot more we can do. So I think we have a lot of opportunities to grow. One of the things that Vinfen has been thinking a lot about is, again, going back to my emphasis on having a system of care, that we are more and more focused on having a program portfolio that is more diverse, so that we can be better equipped to facilitate people's transition from one service to another as their circumstances change, minimize sort of people falling through the cracks because the system is so siloed. So my ambition is to work with my colleagues to grow Vinfen into something closer to an integrated system of care, which we believe is what our consumers need.
Given the council's focus on policy advocacy, we always like to wrap up our programs and conversation talking about policy initiatives. A lot of your resources for human services are at the state level, but if you could talk about some of the organization's top 1 or 2 priorities at the state level that you'd like to see accomplished in the next year or 2.
Well, thank you. That's it's an important sort of emphasis to make. Fortunately, I think that we have covered most of them in this conversation already. We always start with making sure that our workforce has livable wage. So we need
that's $20 an hour, right?
Well, I think we need more like 25, because you talked about Amazon and McDonald's. That's what the market is, and then we need to be aware of that.
Yeah.
The second is investment in community-based services, because we have many gaps in services.
Right.
The third is housing, and because that's such an important part of the support that our clients need, and then our state is not where it needs to be. We have work to do.
Right. On the federal level, I know that digital connectivity is the top priority for Vinfen. And the New England Council shares that priority as well. And we were disappointed that Congress did not take action earlier this year to extend the funding for the Affordable Connectivity Program that was established under that bipartisan infrastructure law a few years ago. So can you talk about why digital connectivity is so important to the population that Vinfen serves?
Yeah, Jim. For people like you and me, I think it's really hard to imagine life without a lot of technology around us, whether we like it or not. That has become the way of life these days. Yesterday, I went to a little restaurant and there was no menu, and you're supposed to take out your phone, and scan a QR code to look at the, that's what life has become for most of us. But if you think about the people that we serve, and many of them are not really in a place to operate a phone, or that they never learned how to navigate technology, that actually sets them further apart relative to where they need to be. So we are very aware of this concept that, you know, when it comes to the digital access, there is an equity issue as well. So Vinfen, for example, works with an alliance within the state of several providers to help our clients access technology. We have what we call digital navigators. These are professionals who will go to our programs and train our clients to use technology and let them know, you know, what are the options for them to access information and make connections with the outside world and express themselves. So this kind of work, which is grant funded, is making such a difference in people's lives. But unfortunately, every day we are very worried about, you know, this kind of support not being sustainable from a funding perspective, and better still, not being able to get to more people, because nobody should be left out of the ability to use technology and access technology and be helped with technology. So, and then just while we're on this topic, it's I have to emphasize, just broadly speaking, human services as a sector is way behind the rest of the world when it comes to the use of technology. And we really have not benefited from the right policy investment so that we are able to operate in a let's say a digitized world where we could sort of support our work with technology, monitor, manage our performance with technology, integrate with healthcare, hospitals, physicians with technology. We are not where we need to be, and then there's a lot of work that needs to be done here, and then that's a significant policy priority as well.
Speaking of priorities, come January, there'll be a new administration in Washington. What should be on the government's agenda to help improve access to behavioral health care in our country?
So every time there is a new administration, you know, there will be new people in seats. There will be a lot of sort of shuffling, sort of sometimes there will be things that are undone, reprioritizing. So that's inevitable. So I would say we are concerned that the momentum will be somewhat compromised, right? So I guess if I have a wish list, it is not to lose momentum, not to lose the things that have been launched, and because of the shuffling. Massachusetts, for example, is proudly ahead of many other states when it comes to support for our sector in so many ways. That we have done so many things, from housing to workforce training to technology. But many of the things that the state does will require federal support, you know, whether it's a CMS requirement or other things. And so I would hope that there is no loss of momentum on things that have worked. Besides that, you know, if I wanted to just a little bit more ambitious, if you will, I think what we really need is some nationwide movement towards a fundamental sort of elevation when it comes to support for mental health. You know, if there's another Build Back Better type of framework that is determined to do something decisive around childcare and pharmaceutical affordability and climate change, mental health needs to be part of that list. And we haven't seen that yet, but we desperately need it. So I hope that the new administration will really put us, you know, on a list of priorities and do something significant and meaningful.
Yeah. Well, I agree with you, and I hope that the new administration and will be able to work together on behavioral health, because it's not a red issue. It doesn't just
Yes.
affect people in the red states, just doesn't affect people in the blue states. It affects all of us in our country. So you would think it would be an issue that they can embrace and say this affects our constituents, constituents. So hopefully the powers to be will find opportunities to find common ground to work on issues such as this that many of us look on the sidelines saying it's a no-brainer, quite frankly. Why aren't we working together on this? So I share your optimism. I share your wise counsel on what the administration should be doing. Gene, thank you very much for joining me today. And more importantly, thank you to everyone at Vinfen for the incredible work that you are doing to improve access to services for people with disabilities and other life challenges, to say the least. And for those of you tuning in, I hope that you learned something from our conversation here today. Please join us in our next episode featuring Lisa Whalen, the New England president of National Grid.